I once again greet you in the name of Jesus. It's my hope that you are doing well wherever you are. My viewers across the globe, it is my sincere hope that you are doing well. I did a video here and introduced myself and the initiative that I usually have about creating health awareness. It was very comprehensive, and today I would want us to know something small, and I believe that we are going to learn something which is going to change our attitudes, which is going to change our lifestyles and all that. And so today, before I start, I said that we deal with all the aspects of health, but I said that our main emphasis is on sexual reproductive health, because that is where the main problem is. As you can see, when you look at sexual reproductive health, you will find that most of the women of reproductive age are really in problems. We have cancers of the cervix, cancers of the breast, and other gynecological conditions which are very common in the sexual reproductive age. And therefore, our emphasis as Mtumishi Ishmael Volunteer Health Talks is on sexual reproductive health. I'm not saying that we don't deal with others like mental health, depression, and other things. We do, but our emphasis is on this. And therefore today, there is something that many people have been asking me to discuss here. And I thought it is good for me to come live and say this. I will do a video comprehensively to discuss this. So people have been asking me about family planning. I've been receiving a lot of messages in my DM, in my inbox, people asking me to discuss about family planning. And because it is a comprehensive topic, I thought today it's good to mention something very small, and then I promise to do a video the other time. And therefore, family planning, what is it? And is it good? Is it really appropriate? Why should people do family planning and all that? I will answer those questions in my next video. And therefore, many people have been asking me, which is the best method of family planning? Which is the best method of family planning? Allow me to say that we have various methods, my dear viewers, and I will answer the questions that have been asked by giving four things. Four things in terms of the characteristics of a good method of family planning. Because I will discuss the methods here, I will discuss the mechanisms here and the importance and all that. But today I want to answer the question, just one question that I've been asked about what is the best method of family planning. And therefore, I will start by saying that we have various methods, and a good method of family planning should have four characteristics, should possess four characteristics. And the characteristic number one, I'm discussing about the characteristics of a good method of family planning. A good method of family planning should not disrupt your menses. Once you choose a particular method of family planning, it should not interfere with your menses. What I mean is, it should not cause irregularity of your menses. It should not cause heavier flow. It should not cause spotting in between your periods. It should not lead to painful cramps. It should not lead to delayed periods. a good method of family planning should not disrupt your menses. In other words, it should not affect the normalcy of your menses. So any method that you choose should be good, should maintain your periods, should not cause the things that I've said, like painful cramps and all that, irregularity, delayed periods, ama heavier flow, yeah, increased amount, increased bleeding. No, it should not do that. Number 2, a good method of family planning should be convenient. It should be convenient. How? When you choose a particular method of family planning, let's say you have chosen IUD, intrauterine device, or the coil. If you have chosen a coil, to use a coil, and then after a month you decide, no, I need to get a baby, once you remove it, you should be able to conceive. You should be able to conceive. So it should not be like it has affected your ability to conceive. I don't know whether you're understanding me. Or rather, it should not cause infertility. It should not interfere with your ability to conceive. Your method should not cause infertility, affect your ability to conceive and all that. So any method that you choose should be convenient. The other characteristic of a good method of family planning is any method that you choose should not cause weight changes. It should not cause weight changes. It should not make you lose weight. It should not make you gain weight. So it should not affect your weight. Your weight should remain the normal. It should remain the same. So when you take, let's say I used the same IUD. If you choose IUD as your preferred method, and you were like 60 kilograms, we weigh you tomorrow or after a week, we find that you have added 10 kilograms. You are 70 kilograms now. No, it should not do that. Or you were 60 kilograms and now we have taken your weight and you are like 45 kilograms. Kwa hivyo haifai kukupunguzia uzito ama kukuongezea. It should not affect your weight. And lastly, any method that you choose as a method of family planning should not lead to other medical conditions. It should not lead to other medical conditions like hypertension. Some methods will cause other medical conditions, like they will increase your blood pressure. So it will lead to hypertension. So, my dear viewer, it is my urge this evening that you consider a method that will not lead to other medical conditions like hypertension. I have given an example. So we can do a recap. I have said that a good method of family planning should possess 4 characteristics. Number 1, it should not affect your menses, your menstrual flow, your menstrual cycle. It should not affect it. Negatively, it should not. Number 2, it should be convenient. It should be convenient. It should not cause infertility. Or rather, when you choose to withdraw the method, you should be able to conceive. Number 3, it should not cause weight changes. And lastly, it should not cause other medical conditions like hypertension. So I will do a video comprehensively about the methods and all that, their disadvantages and all that, so that we may be able to understand. Because many people have been asking me, Ishmael, can you talk about this? I promise that I am here to talk about this. Make sure you tune in to our YouTube channel, Ishmael MIVHT. Search and you'll find all the videos that we have done there. Thank you so much. And in case you have a question, you can always ask for clarifications. Thank you and God bless you. Shalom, and I love you so much.